everyone, Dr. Ann here today, and we're going to talk about fats. Fats as a source of energy. So as I said before, carbohydrates, proteins, and fats all provide the body with energy. But each of those macronutrients has a different job. And so for fats, we want to talk about that in terms of what we do here at the office because we run a weight loss clinic. Obviously, we have some stored fat. So we use fat for energy when we have stress that is long-standing, acute when we are using carbohydrates for energy, intermediate when we are using proteins for energy, but certainly chronic by the time that we get to fats for energy. This is where we start to see insulin resistance and more severe blood sugar handling problems, even moving into pre-diabetes, metabolic syndrome. So fats are really important in the body because each of our cells is made up of a double layer of phospholipids. Lipids is another word for fat. So the integrity of our cell membranes is important if we get fat into our system properly. So again, we can either have more fat coming into our system than we're able to digest, or not enough fat to maintain our normal processes. Nerve health is also important here from a chiropractic standpoint because the coating or the myelin sheath over the nerves, how those nerves signal one another, is the integrity of that is maintained because of the fat that makes up that myelin sheath. When fats are digested, again, we carry in certain minerals. So we're talking again about, just like with protein and fat, digestion starting in that acid environment of the stomach, and we're bringing in sulfur, phosphorus, iron, chloride. Now the difference here when we move to fat, remember as our school bus, we have different children this school bus is picking up now, don't we? We have our fat-soluble vitamins. We have vitamin A, vitamin D, vitamin E, and vitamin K. Now if you have a difficult time, and you would know that from our 24-hour UA that I talked about in a different video, if you have a difficult time bringing fats into the system properly, you're going to have a hard time utilizing and bringing in these fat-soluble vitamins. So you could have, again, with vitamin A, some problems with the eyes. Vitamin E, that particular vitamin is used to stabilize the musculature of the low back, so we might see some low back issues here. Vitamin A, skin. This is where we see dry skin. This is where we see psoriasis. These fat-soluble vitamins and fat itself helps to produce cholesterol. What they call our bad cholesterol is actually the cholesterol we use to produce our hormones for pregnancy. So somebody over here with a fat digestive problem, ladies, you might be one of those women who is having an inability to conceive. You might also have had a pregnancy where you were unable to initiate your own labor. That all has to do with fats. Tremors, slight shakes that people have in their hands. That again is nerve conduction. That has to do with fat metabolism. In terms of chronic degenerative disease over here, diabetes is probably the big one that we look at. But in our office, the reason that we look at fat is again with our weight loss. So if we can help you to decrease inflammation and to eat low glycemic index foods, we can reduce the amount of fat storage that takes place in the body. That fat storage is a result of an imbalance between cortisol, which is a hormone that is made primarily from the protein over here, and insulin that is secreted as a balancing mechanism in the body. But again, this is diabetes, this is heart disease, all of those brain things, Alzheimer's, dementia, they're really relating the brain because it's 70% fat to problems with fat digestion. So again, tremors, psoriasis, dry skin, spontaneous abortion, inability to conceive, inability to initiate your own labor, those are all the things that you'll see when you have problems digesting and utilizing fat. So if any of those are problems that you're suffering with, give us a call. I'm more than happy to help you sort through that and get you back to health. Thanks for listening. It's Dr. Ann.